ਹੁਣ ਅਸੀਂ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ ਕਾਸਮੈਟਿਕ ਐਂਡ ਮਾਡਰਨ ਡੈਂਟਿਸਟਰੀ ਦੀ। ਇੰਦਰ ਜੀ, ਸੋ ਮਾਈ ਕੁਐਸਚਨ ਟੂ ਯੂ, ਜਿਸ ਤਰ੍ਹਾਂ ਅੱਜ ਕੱਲ ਵਾਈਟਨਿੰਗ ਦਾ ਟ੍ਰੈਂਡ ਚਲਾ ਹੈਗਾ, ਸੋ ਇਜ਼ ਇਟ ਸੇਫ ਫॉर आवर टीथ और इट्स जस्ट लाइक?
Generally, yes, it's safe. There are lots of different types of whitening treatments. There are toothpaste which really don't work.
ਲੋਕਾਂ ਦੇ ਵਿੱਚ ਫॉर ਸਾਊਥ ਏਸ਼ੀਅਨ ਕਮਿਊਨਿਟੀ ਦੇ ਵਿੱਚ ਵੀ ਕਹਿ ਲਓ ਤੁਸੀਂ ਮਾਊਥ ਵਾਸ਼ ਜੋ ਅੱਜ ਕੱਲ ਚੱਲ ਰਹੇ ਨੇ ਨੋਨ ਐਲਕੋਹਲਿਕ, ਸੋ ਇਹਦੇ ਵਿੱਚ ਕੀ ਡਿਫਰੈਂਸ ਹੈਗਾ ਤੇ ਕਿਹੜਾ ਮਤਲਬ ਲੋਕਾਂ ਨੂੰ ਲੱਗਦਾ ਹੈ ਕਿ ਮੇਬੀ ਮਾਊਥ ਵਾਸ਼ ਕਰਨਾ it's good for health, so is it safe for our teeth?
Mouthwash is safe for your teeth. I think the reason why they have two types, so traditionally mouthwash has alcohol in it. So people need to, most people are not aware of that. There is alcohol in it. Not a lot, but just a little bit.
How does oral health affect overall body health?
Oral health is linked to the immune system. So if your body's immune system is compromised, for example, you've had a kidney transplant, or you've had some heart operations and you're very sensitive to your immune system is sensitive, and then orally you must be very, very healthy.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਮੈਂ ਹਾਂ ਅਨਮੋਲ ਕੌਰ ਤੇ ਮੈਂ ਤੁਹਾਡੇ ਲਈ ਲੈ ਕੇ ਆਈ ਹਾਂ ਤੁਹਾਡਾ ਖਾਸ ਪ੍ਰੋਗਰਾਮ ਹੈਲਥ ਐਂਡ ਵੈਲਬੀਇੰਗ। ਇਸ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਅਸੀਂ ਗੱਲ ਕਰਦੇ ਹਾਂ ਹੈਲਥ ਦੇ ਨਾਲ ਜੁੜੀ ਕੁਝ ਜ਼ਰੂਰੀ ਗੱਲਾਂ ਦੀ, ਤੇ ਇਸ ਵਾਰ ਦਾ ਟੌਪਿਕ ਹੈ ਡੈਂਟਲ ਹੈਲਥ। ਤੇ ਇਸੇ ਬਾਰੇ ਸਾਡੇ ਨਾਲ ਗੱਲਬਾਤ ਕਰਨ ਲਈ ਜੁੜ ਰਹੇ ਨੇ ਡਾਕਟਰ ਇੰਦਰਭਜਨ ਸਿੰਘ ਪਲਾਹਾ ਜੀ, ਜੋ ਕਿ NHS ਦੇ ਵਿੱਚ ਡੈਂਟਿਸਟ ਨੇ। ਸੋ ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ ਇਸ ਪ੍ਰੋਗਰਾਮ ਨੂੰ ਔਰ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ। ਡਾਕਟਰ ਜੀ, ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਤਾਂ ਪੰਜਾਬ TV ਦੇ ਵਿੱਚ ਬਹੁਤ-ਬਹੁਤ ਸਵਾਗਤ ਹੈ।
ਮਿਹਰਬਾਨੀ।
ਸੋ ਮਾਈ ਫਰਸਟ ਕੁਐਸਚਨ ਟੂ ਯੂ ਕਿ ਸਾਊਥ ਏਸ਼ੀਅਨ ਕਮਿਊਨਿਟੀ ਦੇ ਵਿੱਚ ਡੈਂਟਿਸਟ ਦੇ ਕੋਲ ਜਾਂਦੇ ਟਾਈਮ ਕਾਫੀ ਜ਼ਿਆਦਾ ਨਰਵਸਨੈਸ ਹੁੰਦੀ ਹੈ
ਜੀ।
ਸੋ ਕਨਫਿਊਜ਼ਨ ਵੀ ਹੁੰਦੀ ਹੈ, ਨਰਵਸਨੈਸ ਵੀ ਹੁੰਦੀ ਹੈ ਐਂਡ scared bhi hunda hai. So what is the reason behind of this?
Traditionally, I think dentists have always been rough in the past. India maybe, right? Anesthetic, any use karte si pehle, right? So people were scared that they would have teeth taken out without anesthetic. So and also they were scared of needles. When they did put needles in, were they very rough with them? Ajkal we use very sort of finer needles. We use surface anesthetic, as we use gels, sprays and things, just to settle the area down before we put the needle in. So it's much more gentle now. Our techniques are much better as well, more refined. So you don't need to be scared. But from the past, people remember the past.
So quite advanced technology now.
It's improved a lot. There's a lot.
ਸੋ ਕਿਹੜੀ ਡਿਜ਼ੀਜ਼ਸ ਹੈਗੇ ਹੈ ਜਿਹੜੇ ਕਿ ਸਾਡੇ ਟੀਥ ਨੂੰ ਖਰਾਬ ਕਰਦੇ ਨੇ?
Diseases, smoking is actually quite bad for you. Other diseases would be more cancer related, cancer treatments or chemotherapy, radiotherapy. They don't damage the teeth directly, but they will damage the salivary glands, for example, so you don't get enough saliva. If there's no saliva flow, that the mood dry ho janda hai, right? And then food sticks, soften it in there, and you're getting lots of problems with it. So linked to cancer, linked to smoking. There's other things as well.
All right. So ਤੁਸੀਂ ਹੁਣੇ ਕਿਹਾ ਕਿ they both are interconnected, like?
Yes.
So ਲੋਕਾਂ ਨੂੰ ਕਿਵੇਂ ਪਤਾ ਚੱਲੇਗਾ ਕਿ ਹਾਂ ਉਹਨਾਂ ਨੂੰ ਇਸ ਤਰ੍ਹਾਂ ਦੀ ਡਿਜ਼ੀਜ਼ ਅੱਗੇ ਫਿਊਚਰ ਦੇ ਵਿੱਚ ਹੋ ਸਕਦੀ ਹੈ? ਇਫ ਤੁਹਾਡੇ ਟੀਥ ਦੇ ਵਿੱਚ ਛੋਟਾ ਮੋਟਾ ਪੇਨ ਹੈਗਾ ਹੈ ਜਾਂ ਕੋਈ ਗਮ ਦੇ ਵਿੱਚ ਕੁਝ ਪ੍ਰੋਬਲਮ ਹੈਗੀ ਹੈ?
Cancer doesn't cause the pain in the tooth, right? So this is why people are scared or darde hai, because they think, oh, it's right, something's happening, surge pay or something, I've got cancer. Straight away, darde hai. It's not necessarily the case, right? Cancer does happen from there, but if you're in doubt, just go and see the dentist, right? They will check it, they will assess everything, and then if they feel they're not sure, then they will refer to the hospital for a second opinion. Right, so always, if you're not sure, go and see a dentist, and they will give you that reassurance, and they'll take care of you.
ਕਿੰਨੇ ਟਾਈਮ ਪੀਰੀਅਡ ਕਿੰਨੇ ਟਾਈਮ ਦੇ ਵਿੱਚ ਕਿਸੇ ਨੂੰ ਡੈਂਟਿਸਟ ਦੇ ਕੋਲ ਜਾ ਕੇ ਆਪਣੇ ਟੀਥ ਦਾ ਚੈੱਕਅਪ ਕਰਾਉਣਾ ਚਾਹੀਦਾ NHS ਦੇ ਵਿੱਚ? ਇਸ ਐਨੀ ਪਰਟੀਕੂਲਰ ਟਾਈਮ ਔਰ ਜਸਟ regular?
It varies a lot. There are some people, on average, it's every 6 months. But there are some people are brilliant at cleaning their teeth, absolutely perfect teeth. They might go once a year, right? There are some people very bad, right? Or they've got conditions, right? They might be on certain blood pressure tablets, which swells their gums up. They might be on post-cancer treatment where they need to come more regularly. They might go every few months to have their teeth cleaned, right? And maintain everything. So it varies on the people.
How does oral health affect overall body health?
Oral health is linked to the immune system. So if your body's immune system is compromised, for example, you've had a kidney transplant, or you've had some heart operations and you're very sensitive to your immune system is sensitive, and then orally you must be very, very healthy. So you must keep that maintained.
So you are a dentist in NHS. So if we are talking about South Asian community, so South Asian community ਦੇ ਵਿੱਚ dental problem ਕਿੰਨੀ ਜ਼ਿਆਦਾ ਵੇਖਣ ਨੂੰ ਮਿਲਦੀ ਹੈ ਔਰ ਕਿਸ ਤਰੀਕੇ ਦੀ problems ਹੁੰਦੀ ਹੈ?
I think it varies. A lot of people, right, when they come from India, in India, I suspect the oral health education, or they don't teach you very well how to clean your teeth, right? And that side of it is probably poor. So a lot of people that come from India, right, they haven't got that education. A lot of British Indians, they're taught from the beginning, right? At school, they're taught in schools, right? They're educated throughout, so it's part of that. So they're taught how to clean their teeth. Parents have learned the hard way. They've had their problems and they don't want their kids to have any problems. So they make extra effort to make sure their kids' teeth are clean. But generally, it's where if they come from a background like India, they haven't been taught properly.
So ਕਿਹਾ ਜਾ ਸਕਦਾ ਹੈ knowledge, awareness.
Awareness and knowledge,
Yeah. So diet ਕਿੰਨੀ ਜ਼ਿਆਦਾ important ਹੈਗੀ ਹੈ dental health ਦੇ ਲਈ?
It's to do with sugar and acid. Simple terms. Nowadays there's sugar in everything. You get direct sugar and you get indirect sugar. Even things like ketchup has got a lot of sugar in there, right? So you're looking at sugar, then you're looking at acidic. So a lot of acidic drinks. So people are having so many of these fruit juices and not just Cokes, but these Monster, these sort of energy drinks and things. They're full of sugar and acid. And when you have a lot of acid exposed to the teeth, it will damage the surface of the teeth. And it can start weakening the surface, and it then is more susceptible to decay and other damage.
ਹੁਣ ਅਸੀਂ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ ਡਾਕਟਰ ਜੀ ਸੋ ਲੋਕਾਂ ਦੇ ਵਿੱਚ ਫॉर ਸਾਊਥ ਏਸ਼ੀਅਨ ਕਮਿਊਨਿਟੀ ਦੇ ਵਿੱਚ ਵੀ ਕਹਿ ਲਓ ਤੁਸੀਂ ਮਾਊਥ ਵਾਸ਼ ਜੋ ਅੱਜ ਕੱਲ੍ਹ ਚੱਲ ਰਹੇ ਨੇ ਨੋਨ ਐਲਕੋਹਲਿਕ ਸੋ ਇਹਦੇ ਵਿੱਚ ਕੀ ਡਿਫਰੈਂਸ ਹੈਗਾ ਤੇ ਕਿਹੜਾ ਮਤਲਬ ਲੋਕਾਂ ਨੂੰ ਲੱਗਦਾ ਹੈ ਕਿ ਮੇਬੀ ਮਾਊਥ ਵਾਸ਼ ਕਰਨਾ it's good for health. So is it safe for our teeth?
Mouthwash is safe for your teeth. I think the reason why they have two types, so traditionally mouthwash has alcohol in it. So people need to, most people are not aware of that. There is alcohol in it. Not a lot, but just a little bit. But they do manufacture some non-alcoholic versions, zero versions. So like Listerine will have Listerine and you get Listerine Zero. So there's some people in the community that will not have any alcohol, absolutely fine, right? And for them, there are options. Mouthwash is generally very good. How it works is it reduces the bacteria. So it's like an antiseptic. And if you need to reduce the bacteria count in the mouth for whatever reason, there's gum disease, or if you're unhealthy, if you need to sort of protect your immune system, right, then it's a very good thing.
So mouthwash or toothbrush per day, मतलब अगर age ਦੀ ਗੱਲ ਕੀਤੀ ਜਾਵੇ ਜੋ ਛੋਟੇ ਬੱਚੇ ਹੈਗੇ ਜਾਂ middle age group ਹੈਗਾ ਜਾਂ older age group ਹੈ ਕਿੰਨੇ time मतलब दिन में 2 times brush करना चाहिए मतलब ਉਹਦੇ ਕੀ ਹੈਗੀ ਹੈ?
It's a complicated answer. Right? For young children with baby teeth, you don't need any mouthwash. The teeth are so small that simple brushing is enough with a tiny, tiny little bit of toothpaste, right? Twice a day, and you get them in a habit. Teach them so they know how to do it. As you get newer teeth, those teeth are bigger, right? If the teeth are overlapping, right, then it's difficult to brush in between. So a liquid can get in a bit deeper, so the mouthwash helps because it penetrates deeper. As they get older and the gums start to recede, right, then they're longer in the teeth size is bigger, so you don't need to just brush your teeth, you need to go a bit further down and also make sure you brush the entire surface of the tooth. Mouthwash helps there because it can go in between the teeth and it's more thorough.
तो ਮਾਊਥ ਵਾਸ਼ ਕਰਨ ਤੋਂ ਬਾਅਦ ਇਨਫੈਕਸ਼ਨ ਦੇ ਨਾਲ ਤੁਸੀਂ ਥੋੜਾ ਸਾ ਮਤਲਬ ਸਿਕਿਉਰ ਹੋ ਸਕਦੇ ਹੋ, ਰਾਈਟ?
You're reducing the bacterial count, and that would in turn reduce the infection rate.
So what cause tooth sensitivity and how can it be treated?
Sensitivity can occur. One, it could be with age. As the gums recede, so the root surface, which is normally covered with a gum, that's exposed, and that's very sensitive surface. So you can get that with receding gums. You can also get that if you're very aggressive with your brushing. Some people want to really keep their teeth clean, and they're a bit too hard with their brushing, and they will scrub away their gums and then expose the root, which is sensitive. Other types could be from a lot of acid. We talked about acid earlier on in the diet. If you have a lot of acid, you thin the enamel, and so you've reduced the insulating ability of the enamel, right? And so then they feel that cold and the hot more, so it becomes more sensitive.
Oh, so you are talking about sensitivity. So ਜਿਹੜੇ ਕੁਝ ਲੋਕ ਜਿੱਦਾਂ ਤੁਸੀਂ ਡਾਈਟ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਸੀਗੀ ਬਿਫੋਰ ਦਾ ਬ੍ਰੇਕ,
ਜੀ
ਜਿਹੜੇ ਲੋਕੀ ਪਾਨ ਸਮੋਕ ਕਰਦੇ ਆ ਉਹਨਾਂ ਦੇ ਉੱਤੇ ਕਿੰਨਾ ਇੰਪੈਕਟ ਪੜਦਾ ਉਹਨਾਂ ਦੇ ਡੈਂਟਲ ਹੈਲਥ ਦੇ ਉੱਤੇ?
Barn, I've seen lots of results with barn. It's very bad when you add tobacco to the barn. Generally, over many, many years, it's not something that happens immediately. You'll find that the soft tissues or the cheeks inside, they become very hard. They become fibrous, like leather, really stiff, and people cannot open their mouth properly. And once they get restricted opening, then they can't clean their teeth properly. And then you get decay, gum disease, all sorts of issues. That with the tobacco, you've increased the risk of oral cancer as well, right? So, and I've seen patients where they've had oral cancer and they've literally had to have the jaw cut out, right, and reconstructed, and the faces are all funny and all sorts of that. So it's really bad, right? So that's something we encourage people to stop. Smoking affects the gums as well. Obviously, you've got the tobacco, which is an oral cancer risk, but predominantly the gums. It causes inflammation of the gums. It spoils the gums. Softens the gums, and it's an accumulative damage. So they can be smoking when they're young, stop, but the gum damage is done, right? So you have to maintain and look after it.
So how they can maintain?
We can teach them how to maintain. So you've got oral hygiene. They can find videos on YouTube and all sorts of stuff, other channels, social media. They can show them techniques. But generally, if you go to a dentist or a hygienist, right, then they will show you how to brush your teeth properly, right? And they'll tailor it to the individual person depending on how your teeth are.
So why do some people get cavities more often than others?
Diet, right? So we mentioned about acid, so weakening the tooth. So if the tooth is weaker, it'll break, right? Once it's broken, right, then it will start getting damaged, and the damage will spread internally. That's what decay is, right? Sugar turns into acid as well. So if sugar stays in a certain area and you don't clean it off, or food getting trapped in an area, it breaks down, causes acid. It can start to attack the tooth, and it starts to form a cavity. If you don't brush it out, it'll get bigger.
So what is the early sign that we feel our teeth are not healthy?
The thing is, very early signs you don't know. Patients are not aware. There's no pain, there's no sensitivity. Even small cavities, early decay, people don't feel it. They only feel it when it's big, right? And then you've got a lot more work to do, right? Or they've got a lot at more extreme conditions. That's when they tend to feel the pain. But so we encourage patients to go regularly, maybe on average every 6 months. Just get them checked, because and if there's any early indicators, they can be dealt with quickly.
So how can bad breath be prevented and treated?
Bad breath is usually because there's too much bacteria. Where the bacteria is, it could be that you've got a lot of dirt, a lot of scale, a lot of tartar in the mouth. that harbors bacteria that can cause smell. You could have an infection. It could be that your wisdom tooth, around your wisdom tooth, the gum is very soft around there, and there could be food trapped in there, and that causes smell. So there's lots of reasons why you can get bad breath. You would immediately at home, you'll try your mouthwashes, you'll try brushing your teeth, right? Do everything you can at home. If you're still getting the bad breath, go and see a dentist.
ਡੈਂਟਿਸਟ ਹੈਲ ਨੂੰ ਕਿੱਦਾਂ ਤੁਸੀਂ ਸਿਕਿਉਰ ਕਰ ਸਕਦੇ ਹੋ ਕੀ ਡਿਜ਼ੀਜ਼ ਹੈਗੀ ਹੈ ਜਿਸ ਨੂੰ ਤੁਸੀਂ ਪ੍ਰੋਟੈਕਟ ਕਰ ਸਕਦੇ ਹੋ ਘਰ ਬੈਠੇ ਬੈਠੇ ਤੇ ਹੁਣ ਅਸੀਂ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ ਕਾਸਮੈਟਿਕ ਐਂਡ ਮਾਡਰਨ ਡੈਂਟਿਸਟਰੀ ਦੀ ਇੰਦਰ ਜੀ ਸੋ ਮਾਈ ਕੁਐਸਚਨ ਟੂ ਯੂ ਜਿਸ ਤਰ੍ਹਾਂ ਅੱਜ ਕੱਲ ਵਾਈਟਨਿੰਗ ਦਾ ਟ੍ਰੈਂਡ ਚਲਾ ਹੈਗਾ ਸੋ ਇਜ਼ ਇਟ ਸੇਫ ਫॉर आवर teeth or it's just like
generally yes, it's safe. There are lots of different types of whitening treatments. There are toothpaste which really don't work. They're good at stain removing, but they won't whiten the teeth as such. Usually we would suggest go to a dentist to have it done, because sometimes what looks like yellow teeth might just be staining, right? It might not be the teeth, right? Underneath the teeth might be white. So, they might just need a very good clean, right? And it can improve it straight away. So you do something simple first. If they feel the teeth are still yellow after that, right, then the dentist can use certain chemicals. The dentists are allowed to use a slightly stronger percentage of chemicals than you can buy off the shelf. Right? And they use it and they provide it, and they guide patients on how to use it. They will see them regularly. There's also risks of sensitivity with them. Sometimes we'll see patients whose teeth are too sensitive, and we'll say that you're not right for whitening because it'll make the teeth worse. So yes, it's very fashionable, but I think not every case will work either, right? So it's better to get it assessed to see.
And what about braces and aligners?
Aligners, Invisalign, but not necessarily for everyone, right? And there are some cases where aligners will not work, and where conventional braces, or they're called train tracks, are better, right? So you need to go and see a specialist dentist, ideally someone, a specialist orthodontist, right, who can do both, right? And they will then guide you as to which is the better type. But certainly they're very, very popular now.
Oh wow, that's very good. So my question, we already spoke about children, right? So now we are talking about pregnant women. ਉਹਨਾਂ ਦੇ ਉੱਤੇ teeth ਨੂੰ ਜਾਂ ਜਦੋਂ pregnant ਹੁੰਦੀ ਹੈ ਤਾਂ ਉਹਨਾਂ ਨੂੰ ਆਪਣੇ teeth ਨੂੰ ਕਿਵੇਂ look after ਕਰਨਾ ਚਾਹੀਦਾ?
Very good question. With pregnancy, the main difference is hormones will change, and ladies vary. All right, there are some ladies where they don't have many changes in the mouth. There are some ladies that have lots of changes in the mouth. So as soon as you find out you're pregnant, go and see the dentist. They will assess you. They will assess you more regularly, probably, especially when you start to get, sort of swelling or more bleeding of the gums and things like that. That can happen, right? So, and the dentist will guide you and say, I need to see you every few months, or I need to see you in 6 months, or I need to see you when. So be under the guidance of the dentist, right? So they can ensure that you don't get overtly,
Right. So pregnant women ਦੇ ਵਿੱਚ ਕਿੱਦਾਂ ਦੇ changes ਆਉਂਦੇ ਹੈ?
Usually to do with the gums react to plaque,
Okay.
right? More prevalently than they would when you're not pregnant. So it would mean that, for example, if you have scale and tartar there, for example, right, plaque, the gums might swell up around them, right? So whereas like in a normal person, it may not swell up as much. So you get more exaggerated responses.
And what about ਜਿਹੜੇ older adults ਹੈਗੇ ਉਹਨਾਂ ਨੂੰ ਜਿਨ੍ਹਾਂ ਦੀ age for example 50 plus ਤੁਸੀਂ ਕਹਿ ਲਓ ਉਹਨਾਂ ਨੂੰ ਆਪਣੇ teeth ਨੂੰ ਕਿਵੇਂ look after ਕਰਨਾ ਚਾਹੀਦਾ, ਆਪਣੇ gums ਨੂੰ ਕਿਵੇਂ look after ਕਰਨਾ ਚਾਹੀਦਾ?
Generally, the older people, the gums have receded a little. Over time, right, the gums will recede a little, which means they've got more tooth to clean. So they have to spend more time cleaning them and more thorough cleaning them. And plus, as the gums recede, the gaps sometimes tend to form at the bottom, but not at the top of the teeth, at the bottom where the gums are. So you might get a bit more food trapping in the gum there as well. So again, the dentist or the hygienist will show them how to use interdental brushes and different techniques of cleaning, water flossers, air flossers, and things to help more thorough cleaning of the teeth.
My last question to you, Dr. Inderji. What should someone if they break or knock out a tooth?
It can happen with children, right? They love playing in the playground, and it's happened a few times. We've seen cases where they've literally knocked the whole tooth out. The advice is to quickly put that tooth in a glass of milk, right, and bring it to the dentist, right? And we've done this. We will then just actually numb the area up. Child, bless them, are swollen, cut up, and bruised and stuff. But but we can numb them up. We can reinsert the tooth back in place, right, and then we can splint it, and then we can take care of it after that.
ਬਹੁਤ ਹੀ ਤੁਸੀਂ ਇੰਪੋਰਟੈਂਟ ਇਨਫੋਰਮੇਸ਼ਨ ਸਾਡੇ ਦਰਸ਼ਕਾਂ ਨੂੰ ਦਿੱਤੀ, ਕਿਉਂਕਿ ਜਿਹੜੀ ਆਪਣੀ ਕਮਿਊਨਿਟੀ ਹੈਗੀ ਹੈ ਉਹ ਆਪਣੀ ਟੀਥ ਦੀ ਕਿਸੇ ਵੀ ਤਰ੍ਹਾਂ ਦੀ ਪ੍ਰੋਬਲਮ ਨੂੰ ਬਹੁਤ ਹੀ ਮਤਲਬ ਧਿਆਨ ਨਾਲ ਨਹੀਂ ਨੋਟਿਸ ਕਰਦੇ ਹੈਗੇ ਹੈ। ਆਈ ਥਿੰਕ ਇੱਕ ਸ਼ੋਅ ਦੇਖਣ ਤੋਂ ਬਾਅਦ ਜਿਹੜੇ ਸਾਡੇ ਦਰਸ਼ਕ ਹੈਗੇ ਉਹ ਆਪਣੀ ਟੀਥ ਦੀ ਕੋਈ ਚਾਹੇ ਛੋਟੀ ਸੀ ਵੀ ਪ੍ਰੋਬਲਮ ਹੋ ਉਹਨੂੰ ਜ਼ਰੂਰ ਲੁੱਕ ਆਫਟਰ ਕਰਨਗੇ। ਬਿਲਕੁਲ ਡਾਕਟਰ ਜੀ।
They must. Again, it's the education. The more you look after them and you learn to look after them, the healthier they'll be, and you'll keep them for longer.
ਥੈਂਕ ਯੂ ਸੋ ਮਚ ਡਾਕਟਰ ਇੰਦਰਭਜਨ ਜੀ, ਤੁਸੀਂ ਸਾਡੇ ਪੰਜਾਬ ਟੀਵੀ ਆਏ ਤੇ ਸਾਡੇ ਹੈਲਥ ਐਂਡ ਵੈਲਬੀਂਗ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਆ ਕੇ ਸਾਡੇ ਦਰਸ਼ਕਾਂ ਨੂੰ ਬੜੀ ਹੀ ਇੰਪੋਰਟੈਂਟ ਤੇ ਇੰਪੋਰਟੈਂਟ ਜਾਣਕਾਰੀ ਦਰਸ਼ਕਾਂ ਨੂੰ ਦਿੱਤੀ ਡੈਂਟਲ ਹੈਲਥ ਦੇ ਬਾਰੇ। ਸੋ ਅਗਲੇ ਹਫਤੇ ਅਸੀਂ ਫੇਰ ਮਿਲਦੇ ਹਾਂ ਕੁਝ ਨਵੇਂ ਟੌਪਿਕ ਦੇ ਨਾਲ। ਵੇਖਦੇ ਰਹੋ ਪੰਜਾਬ ਟੀਵੀ ਸਕਾਈ 761।
पंजाब टीवी, अपनी बोली अपना देश।